Right, hi guys. I thought I'd go over the assignment for rehab sports injuries, okay, and just kind of give you some advice on where to improve your assignments because all of you do have resubmissions to do, okay. So first of all, we're looking at P6, M3, and D2. Now, design a safe and appropriate treatment and rehabilitation program for two common sports injuries with tutor support. Independently design a safe and appropriate treatment and rehabilitation program, and then finally, through distinction, you have to evaluate it. Now, a lot of you, in fact, the majority, have actually pretty much covered a lot of the distinction criteria by evaluating what treatment method you're going to be using. However, all of you haven't actually produced an actual plan per se, and that's what we're going to go through today, okay? So first of all, just to remind us of the actual task, first of all, you have to write a report that includes your design of a safe and appropriate treatment and rehabilitation program for two significantly different injuries. We've already discussed those. One is going to be an ankle injury for basketball and one is a hamstring injury for football. They're both grade 2 injuries. Now, the report should include the following: a description of the 5 stages of rehab, the methods to improve the range of movement, e.g. different types of stretching, strengthening exercises you would use, psychological aspects, and a description of how the program will be monitored. I won't dwell on this for too much, just get straight over to the template and then discuss where you essentially went wrong, some of you anyway. So first of all, with regards to stage 1, the immediate post-injury, first of all, in here you're discussing what the purpose of this stage is, and then we're going to be discussing the treatment. Now, a lot of you have done this very well, but just to go over it, phase 1, immediate post-injury, this is the purpose of it. We're trying to assess the injury, prevent initial swelling, and protect the injured part from further damage. We do this by using saw taps. Now, all of you have mentioned this. However, some of you haven't gone into enough detail with regards to saw taps. When it comes to saw taps, you're going to be discussing each one individually with regard to the injury. So, the SC. So, with the basketball injury, you saw the player take a jump shot. As they've landed back down the floor, they've landed on an opponent's foot, and you have seen them plantar flex and invert, therefore causing a lateral ankle sprain. So when you run on, you know straight away what area of the body you need to be going to look at. Then the A ask, so you ask your client or the actual athlete, okay, where is the pain, what type of pain you are feeling. They will be pointing at their ankle to the lateral aspect of it, and they'll be saying it's throbbing, it's a 6 out of 10 pain. Then you look, what you'll probably see is a bit of swelling, redness, bruising straight away if it's quite bad, okay. Touch, if you touch the outside of the ankle, i.e. the lateral part, it is going to cause pain. From here, the A, active, so you may get them to try and actively move it. Now, actively moving tests contractile tissue. They may not be able to do this, which suggests that contractile tissue, i.e. muscle, has been damaged. The P, passive, you may then do that for them. If they're still getting pain with that, then you know that ligaments, non-contractile tissue have been damaged. And then finally, the S is either strength or stand. I don't mind which one you choose. But essentially what you're doing there is you are testing the active resistive strength of the athlete. If they have no strength, they can't continue to play. Therefore, you have to do first aid treatment of applying ice and get them off the court safely, i.e. with a stretcher, with potentially putting their ankle in a splint at that stage. So that is stage 1 done. Stage 2, the acute stage, so days 1 to 3. Again, the purpose of this, so you're going here. The purpose of this is control bleeding and swelling, reduce pain, protect them from further damage, apply modifications, and offer advice. How are you going to achieve this? You're going to achieve this by actually applying police. So treatment is the police, so protection. For the ankle injury, you're going to protect the injured limb with either a splint or a space boot. The space boot, i.e. a plastic boot, protects it from getting damaged if you bump into something. It also offers natural protection with regards to weight bearing. That is your protection for your ankle injury. Your optimal loading is also the space boot because that actually takes some of the load for you, so you're not applying all of your weight through that space boot. You can also use crutches for optimal loading at this initial stage, and that is what it's going to be at the initial stage. Ice, compression, elevation. Here, just explain why you're actually using ice. You're using ice to decrease swelling. The reason you want to decrease swelling is because it causes pain. That is the same for compression. Compression decreases swelling, which therefore decreases pain. And elevation, you're getting blood flowing to the heart, lymph nodes are being used, so waste products are going to the lymph nodes, which again is going to reduce swelling. So that is stage 2 spoken about. Again, a lot of you have done that. Now, this is where people start to struggle on stage 3, 4 and 5, okay. Like it says, you have to independently actually create a program. Now, I don't want it in table format or anything like that, but you need to talk specifically about the exercises you will be using. So, purpose of stage 3, you come over to the slideshow. Absorb swelling and protect products from inflammation. How are you going to do this? Well, hot and cold therapy, massage, elevation. Talk about it in detail, how they're actually going to absorb swelling. You'll get this online on Moodle, the information is there. Okay, another purpose of it is to promote healing and assist growth of new cells. You're going to do this through hot and cold therapy. Protect from further injury, uses of bandages. With regards to ankle, there is a specific taping technique called basket weave, which really restricts the movement. When you're restricting movement, it means the ligament's not going to get damaged as much. Okay. Development of scar tissue. So for that, you're going to be doing stretching and massage. Introduce non-weight bearing mobilization exercises. So that's range of motion exercises. And then the last one, strengthening exercises. Once you've actually described them in the purpose here, the actual treatment, what I want you to do is give me a list of non-weight bearing range of motion exercises. 3 or 4 exercises you'd actually get your client to do. Talk about reps and sets, so you'd get them to do 10 to 15 reps, 3 sets, 3 to 5 times a day. And literally give me the name. So active dorsiflexion, active inversion, active eversion, active plantar flexion. They are going to be your non-weight bearing motion exercises. You can use a towel that some of you have actually spoken about. In regards to strengthening, you're doing the same, but you're talking about it with a TheraBand or isometric strengthening, but you're actually giving me 3 or 4 bullet pointed exercises. So if we go to the Moodle page, I've put on here, there's loads on here now with regards to hamstring injury rehabilitation and then ankle. So here, if you click on this one, you've got information about lateral ankle sprain here. Then in regards to actual exercises you have here, so range of motion exercises, your doctor will ask you to practice moving your ankle after an ankle sprain. Do these exercises 3 to 5 times per day. ABC's exercise, trace the entire alphabet with your big toe 3 times. That is doing range of motion exercises, which is appropriate for stage 3, non-weight bearing range of motion exercises. Strengthening exercises are going to be things like these toe curls, okay, or anything with a towel that again is not weight bearing, you're sitting down, you're not causing too much pain. Stretching exercises, so they're using a towel here. Got another one here which is them standing stretched through the calf. I want pictures and actual descriptions of what you're going to do, okay? Click on another ankle functional rehab. We'll go into that one later when it comes to stage 5. This one here also gives you information with regards to ankle sprains. So you have improving ankle mobility. That will help with stage 3 and 4. This will help with stage 4 and 5. Returning to full fitness, that will help you with stage 5. So, once you've discussed in detail how these help you, I want you then just bullet points, active dorsiflexion with a picture, 3 to 5 times per day. Ten reps, picture, active plantar flexion. You get the gist. So I actually want essentially a rehab program, a program of exercises that you will do. Stage 4, active rehabilitation, week 4, purpose of this stage. Again, go to your PowerPoint, phase 4, there are all your purposes there. That is how you're going to achieve each one of these. Talk about why it's important, and then again, as you can see here, we've got range of motion exercises. So again, you bullet point here, range of motion exercises. Talk about here stretching exercises, because if you come to the PowerPoint, stretching and massage, so you talk about stretching, you literally say, okay, you do a calf stretch, hold it for 30 seconds times 3 to 5 times a day. You will do ankle inversion stretch. You can even do a hamstring and quad stretch. You're just going to stretch the whole lower body, and that is what you're going to talk about within these. And then coordination exercises, so your proprioception. A lot of you have spoken about a wobble board, but all you have said is, I'd use a wobble board. Okay, so how long would you get them on the wobble board for? What happens if they, first of all, initially struggle with the wobble board? Perhaps you get them just balancing on one leg on the floor, then you may get them to a pillow, then the wobble board. To make it even more sport specific, you then get someone throwing the ball to them, they catch it, throw it back, maybe they have to dribble with it, the ball on the balance board. Hopefully I'm getting across here where you just have to give, again, bullet points of different exercises. Now stage 4, week 4, you can actually use resistant machines here. So you can use leg press, leg extension, leg flexion, squats, lunges. As long as they're pain-free, you can use them. So you might want to put them in. And again, 3 to 4 reps, 10 to 15 reps, for 3 to 4 sets. Finally, functional rehab. Functional rehab is not just about slow jogging. That is going to be in stage 4. Functional rehab is they're at the end stage of their injury. They are pretty much being tested to make sure they can go and play again. Therefore, in here it's sport-specific movements and techniques. I want you, for basketball and for football, to actually give examples of certain drills and certain skills. If you don't know basketball, you don't know football, if you just literally Google certain things, I know, if I Google basketball functional exercises, here you have the best exercises for basketball players: plyo push-ups, squat jumps, Olympic lifts, jump rope. Okay, you actually have examples. Fun basketball drills, 51 fun basketball drills. That doesn't work. Sod's law. However, you have here, you've got exercises you can use. If you typed into Google functional exercise, maybe go to Google Images. If I type in drills, maybe. Here you have pictures you can use, and it's also giving you ideas that you can use. Ladders here, TheraBand around the waist with resisted, so you're sprinting with the ball, bouncing it. Okay, here are some images that you can actually use when it comes to functional rehab. So it looks like maybe someone's dribbling with the ball diagonally. So during this part functional, again, a bit of a discussion like the majority of you have done, but then you're literally bullet pointing. You're saying, first drill, straight line running. Maybe use a diagram and then give a bit more of a description. Second drill, diagonal running. Going to Google Images, diagonal running drill. All of a sudden, you have little diagonal running exercise here. You can use that and just talk about what you're going to be doing, running from cone to cone, diagonals. Maybe this one, running around the cones, forward and backwards with a basketball, laterally moving, forward moving, backward moving. You need to create